Dr. Rosen, I want you to outline the process for getting a medical marijuana card here in Pennsylvania.
Yeah, sure. I mean, look, a lot of patients are really nervous about the process. They're nervous about meeting a doctor. They're nervous if they're going to qualify. They don't know what to expect. So it's getting patients over that hurdle to help them understand that we're here to help and we're not here to make it difficult, and that it's legal for a reason, and that the stigma that they may have is no longer necessary to carry with them. So the process for my office, because I'm a primary care doctor, and like most doctors that are doing this, they're not only doing medical marijuana, they have other things going on in their practice. So sometimes you're jumping into busy places, and it's not every doctor has it set up where they can easily handle calls for medical marijuana certifications. So in my practice, I actually have a physician advocate. Her name is Rosen. She helps patients to get and understand how to get through the process and how to get their medical marijuana card. So the first thing that we ask of all patients is that they register with the state. So we direct them to the state website. We tell them to register themselves. And in order to be able to participate, they have to have a valid Pennsylvania ID. So we get a lot of calls. Patients, maybe they have a Florida driver's license. They just moved here. They have to wait till they get a Pennsylvania identification. So once they have that identification, they can go ahead and register themselves with the state. Once they're registered, then they're directed to go and make an appointment with a certifying doctor like myself, at which point they would call. We get patients in right away. Most doctors are usually pretty quick with it. Hopefully they are, that they can get patients in. And now with COVID, we're able to do it via telemedicine. The state's allowing telemedicine search and research through the end of November. That hopefully will continue beyond November, but so we can do in-person or telemedicine visits where the patient would then call our practice. Most practices have a charge for that. Most practices do not put it through the insurance because it's not covered by insurance. So there's a cash payment that's involved. We charge $200 for an initial certification and $100 for a recertification, at which point they would pay the fee, and then they would talk with me either in person or via telemedicine. And we would go over all their conditions and their medications and make sure that they have a qualifying condition. There's plenty of qualifying conditions. It would be unusual for a patient not to have a qualifying condition if they have a medical issue that we can work with to make them able to get their card. A big issue that comes up is old records. So a lot of patients say, well, I don't have old records, or I know I have an issue with anxiety, but I've never been diagnosed by a doctor. And the state does not mandate that I have medical records. So it's not 100% necessary. If you have medical records, that's great. They can send it to us via email or mail or bring them in with them. But records are not necessary. The reason why they're seeing a doctor is that I can also make that own interpretation from their history. Just like if you saw me and said you had asthma, I wouldn't say I need records to give you an inhaler. I can still give you an inhaler based on your history to be able to prescribe. So once I determine what their certifying diagnosis is, I tell the patient that they are going to get an email from the state. I put it into my system. My staff puts it in. It takes not a long time. Patients get an email within a matter of 10 to 15 minutes after their visit with me that states that they've been certified. And then at that point, they have to go and pay the state a fee of $50. And then once they pay that fee of $50, they get their card in the mail. A big question that patients ask is, well, how are they going to know, like, how am I going to get a picture on there? They use what's on record with the state through their driver's license. So you get a card in the mail in about a week with your picture on it from your state ID. And at that point, you are good for any dispensary in Pennsylvania. The max we can do it for is a year. Most doctors certify patients for a year, but you may find a doctor that certifies for less time, at which point we'd have to do a recertification. That's pretty much the whole initial process.